being from the health department being Zoom master.
That's
Extraordinary.
great. Okay. Meredith, are we okay?
Yes,
Okay, thank you. Okay.
gonna show
Welcome
you-
to the January 11th, 2021 meeting of the Yarmouth Board of Health. I'm Hillard Bosking, member of the board, and this is a remote participation meeting due to the pandemic. So let's start off with attendance. Mary,
here.
Deborah,
Present.
Eric,
Present.
Charlie.
Present,
That's it. That seems like a yes. And Director Murphy.
present.
Okay, welcome, everybody. So let's start off with the public comment. Anyone calling in, yelling from the outside? Anyone?
Have we had anybody call in? Who? Sign them up. We do have one person from the public.
Oh, great.
Can you allow them in? They're in? Do we need to ask them if they wish to, we do have one person,
Okay, just introduce yourself.
nope, excuse me. No, excuse me, that was not one person, that was something else. So we have nobody from the public available.
So it just dropped 100% down.
Yes.
Okay. Okay, let's move things along. We have an update on coronavirus, believe it or not. Director Murphy, there are a few things listed here under that. One is statistics, age demographics, cases by village, Cape testing sites, meeting, and Board of Selectmen. So why don't you go ahead, Bruce? Thank you.
Okay, what I'd like to do is go over the number of COVID cases that we have in town. I think I can post that up for the board and the public to see. Yep, a little bit more. There you go. Okay, so for the board that has this information in their packet, but for the public at home, that as of today, from the first case of March 11th until today, which is January 11th, and 10 months over that period of time, we've had 728 cases. We currently have 100 active, and this was based on Friday stats. And we've also had 23 deaths. And I think that's new to the board, just to spend a minute on, because what we did is we went back and looked through the death certificates on file at the town clerk's office. Now, some of these people had passed away in a nursing home that they might not have stayed in Yarmouth. They might have picked up COVID in a nursing home when they were there. However, the death certificate states their residency is Yarmouth. So from talking to the state, when they look at deaths, they look at the town that the person passed away in. So we went back, like I said, and worked with the town clerk, and they will bring us, as a death certificate comes through with COVID, to us so that we can track. So that's a newer statistic for the board to look at.
So Bruce, if let's say there's a person who dies in a nursing home here in Yarmouth and their residence in Brewster, that person is listed under Brewster then for
Correct.
statistics.
Correct.
Yeah, okay.
Correct. So interesting enough, our first case, March 11th, was I just called him tonight. I called him this afternoon just to let him know that he was our first known case in Yarmouth, was a 28-year-old male. So we can see how it's developed in 10 months and spread across the community. So he had all the classic signs, and he was the first one recognized at that period of time. So since then, and as you can see now, it's pretty well spread. I want to say it's still community-based between West Yarmouth, South Yarmouth, and Yarmouth Port. And that's also based on the, besides the demographics, the number in living in those areas. Obviously, there's more people living in West and South Yarmouth than Yarmouth Port. We have had a couple small clusters in our nursing homes that have come and gone. When I say come and gone, I should say that they've recovered. The nursing homes are being tested. Some of them are twice a week now, along with the residents and staff. So that's something that we monitor daily.
So
The-
some of those, excuse me, Bruce, some of those
Yeah.
people in the cluster may not be attributed to Yarmouth if their residents, say, for example, was Brewster or Dennis, right?
No, that's only if they pass away.
Oh, okay.
Yeah, it's the pass away on the death certificate, it goes to the town residency.
So for purposes of cases, it's where they are residing at the time that they are diagnosed?
Correct.
So how many were in the clusters?
I believe we had the one cluster at one of the care facilities of, I believe it was about 30.
Huh.
And the other one was at about 15. And since then, they have recovered. They've tested other patients in there. They've also tested the workers and any people that come in, vendors. Since then, they are also getting vaccinations, as the nursing homes are first on the line getting vaccinations. And one started to receive their vaccinations, their first round last week. And we have the other one scheduling shortly for theirs, which I believe was last week and this upcoming week.
Good, thank you.
Yes. Okay. The next shot we have is based on last Friday, is the age breakdown of the 728 positive cases that we've had in town. And we can see how it's developed over the last several weeks, from December 10th, December 18th, up to the January 8th, last Friday. And one of the particular age groups you can see is that 20 to 29. That's really gone up from where they had to 64 in December, and now they're up to 106. So that's an age group that's really increased, along with the 30 through 39 is increased up to 95. So then you can see it's all pretty close in age now, based on our January 8th. At first, it seemed to be higher in numbers to the a little bit older group between 50 and 69, but now you can see that leveling off across the age brackets. And I think that's the important case. We're trying to reach out into the whole community, is the whole community needs to take precautions. It's just not one particular age group. We also see the children increasing quite a bit over that last month, from the 11 to 19-year-olds, from 24 to 45. So obviously the children may be picking it up from their parents also that have increased in that age group. So just another area that we look at, Phil and health inspector in the office watches the numbers every single day, puts these stats together, works with the VNA and state contact tracing every day, and probably spends at least about 80% of his times and on weekends tracking the numbers and working with the tracing and staying in touch with the school nurse if needed. Interesting, down the bottom, we can see the breakdown between male and female, how that's been going. also, with more females leaning towards being positive than males at this period of time.
Anyone have any idea why that's the case? I'm not quizzing you. I'm not sure why.
Well, I'm not quite sure of the data on that one, Mr. Chairman.
Yeah.
Okay, next will bring us into a few graphs that show it differently here a little bit. And it can show the cases that we've picked up from March 11th until our, I believe this brings us up to, again, January 8th. And we can see this chart that the board's familiar with. The first, when the pandemic arrived and we had the cases in April, May, we thought we were getting quite a few cases, and then it went down, which we were. And then it went down during the summer. People were outside. We went 21 days without any cases. And then all of a sudden, everybody goes inside, closer together, and come November, right after Halloween, it increases after Thanksgiving. And we can see it spiking way up into the number of daily active cases that we're following. Last Friday, January 8th, we were following, as noted here, 88 active cases within the community. And we can really see how that's spread out. And I had mentioned before, we had more active cases in November than we did in all of the first 3 months of the pandemic. So the next chart is the daily reported cases that come in each day. Again, at the beginning of the pandemic, we were probably getting 3 or 4 cases a day as an average. Now, since November, it's not been unusual to get 10 or more cases, with several days above 15 or 20, and the one particular day that we had 29 cases. So extremely busy within the health department, working with the nurses, doing the contact tracing, getting back out, ask where people went. And most everything is, the tracing is coming back to households. That's where it's coming back, mainly that they're seeing people getting the cases within the household. It's not, oh, I've been out in a public place here or there. It's coming through the household.
Within households that have been quarantining as bubbles, or because they have expanded during the holidays?
I think a little of both. I think it's people that had people over on the holidays, people that have people come back from college. I think we've also seen it go through a house. We've had one positive in a house, and next we've had 2 or 3 go through the house. So it's also, when we do the contact tracing, just to kind of remember that there is a lag time in the tracing. You know, just to go through the series, the person doesn't feel well for a couple days, then decides, I better go get a test. We'll call for a test, and maybe that's 2 days before they get in, get the test, and then maybe it's 2 days before they get the test back. So hopefully, during that period of time, they're doing self-quarantining. Not everybody, I don't think, has done self-quarantining. I think some people are have either gone back to work or gone to school while they're waiting for test results. Some people just have not stayed home, and I think that's added to the spread. So it's a little of everything of where that is when they go back, and the people that are self-quarantining are also potentially spreading it within the household, if not taking the proper steps.
There's also the lag for contact tracing. In other words, when the results are back, it can take a few days to contact the close contacts for a number of reasons. One, we don't have information on them, how to locate them. People are not answering the phone. Multiple calls go out, letters go out. So there's another part of the delay.
That's correct. If we do see, when Phil's watching it daily, and again on weekends, if he observes somebody that appears to be school age, he will contact the nurse that day, that night, over the weekend, and say that we have a positive student come in, and then we can start working with the schools right away, even on a night or on a weekend. So we have the first jump on it so that kid doesn't go to school and affect the potential a classroom. We've been very good so far. We've had a couple cases within the schools, as we have at all workforce areas, but it has not, and I'll say again, not spread within the schools. We have not had it go through a classroom. So I think by taking the extra precautions that we've been taking and working very closely with our nursing has been a positive step in monitoring the coronavirus cases. Okay, Meredith. Next chart is one that the state puts out. And this came out on last Thursday. They put this out every Thursday of what the cases are. And Meredith breaks it down to the by town. So it gives us a bit of feel of what's going on. And you can see of the 15 Cape towns, a lot of them have now also gone to red high-risk communities. And as we can see that Yarmouth is a red high-risk community for the 5th consecutive week. Our percent positivity has decreased from last week, but we're still in the red community and now joined by most of the other communities on the Cape. We can also see that during the last day, we've had 170 positive cases, and that was also based on over 2,551 tests over that 2-week period in Yarmouth. And some of that is the nursing homes getting tested and staff getting tested twice a week. So that does add to the number. Anything you'd like to add to that, Mr. Chairman, about the positivity rate coming down at all?
No, it's pretty close to what the state is running at for the positivity rate.
Correct.
But let's kind of remember that a good percentage of the people who are infected don't have any symptoms. So let's just keep that in mind.
Correct. And now we have the total tests that has increased since last week, but that's also because the Melody Tent is open for testing, along with the county fairgrounds availability for testing. So I think that just also shows, besides seeing community spread within our community, we're also seeing the community spread on the whole Cape. It's just not between Barnstable and Yarmouth or off Cape. It's spreading throughout the Cape. So as another reminder why people need to take precautions.
Bruce, anything the public should know about getting tested? For instance, over the Melody Tent, what do they need to know?
They can, there is a number available. If they type the Melody Tent testing, a number will come up, or the county health department. And I believe we have that number up on our website also.
Thank you.
Okay.
Do they need a doctor's referral, Bruce, or can they just go on the website and make an appointment?
I believe they can just go on the, make an appointment.
Whether they're symptomatic or asymptomatic doesn't matter.
Correct. I believe that's the case. Next chart. This next chart is one the chairman monitors, and I'll let him explain this chart.
Yeah, if you check your emails, I sent out one earlier today, just to simplifying, making it a little bit easier to visualize that bottom axis, the x-axis there a little bit. It's just showing that orange line, just the general trend over, a week at a time. I'm not sure we've reached a peak from the holidays yet. In other words, we're only 2 weeks post-Christmas and so on. So we may be seeing quite a few more. That's all just from that holiday time alone. But if anyone has any questions, go ahead. It looks pretty straightforward. It just continues to go up overall.
And you're grouping in a 7-day average as you go, so you can just follow it that way also.
Yeah.
Okay. Good. So precautions that we keep mentioning is avoid gatherings, dinner parties, avoiding birthday parties, sleepovers, play dates, avoiding carpools unless family members, if not family, wear a mask. These are the questions that come up when we're doing contact tracing. People will say, oh, yes, we just had a dinner party, or oh, yes, we had the kids on a sleepover. So we're still hearing some of these precautions people are not following. And I think, the community as a whole needs to work together on this based on all the ages. Again, if you don't feel well or are waiting for a test, you need to stay home and do not go to work or school. You need to do these to stop the spread. Mask up, social distance, wash your hands. We've also placed additional signage. We have one sign across from Town Hall here, a message board saying these things. We've also had a second one that we're able to get from the fire department, was able to get from the county, and we put down on Route 28 by West Yarmouth Road. And then we just added a third board, message board up at the landfill that the police department was able to relocate theirs up to the landfill, along with the landfill put up quite a few little signs, wear a mask as you go through. So we've added some extra message boards to get out within the community.
Despite the signage, there's still quite a few folks there unmasked, unfortunately.
Well,
I was there today. Yes, you're absolutely right. I'd say a third of the people there today were not wearing masks.
and I think that's why it's still continuing to spread within the community. And I think that's the message that we keep trying to get out, is it's a community-wide effort from all ages and all parts of the community, is that mindset that you need to wear a mask at all times. It's just not, oh, I'm only up the landfill and I'm throwing my trash away for 30 seconds. Well, it's getting into the habit of wearing a mask at all times when you're out in public, which is the governor's order. So it's getting that in all the time, because we're still following up on complaints that, oh, people aren't wearing a mask when they're going into this store, or the people in that store don't have a mask on. So as the pandemic keeps to spread, everyone needs to take those precautions, and we need to get the town in the mindset of what do we need to do as a town to decrease us out of a red community. And I think it's as simple as social distancing, wearing a mask, and getting in that mindset. If not, the town will remain in a high-risk red community
This is after 10 months.
after 10 months.
The behavior hasn't changed all that much,
No.
unfortunately.
Okay.
Maybe I'm not getting out as much, and I'm not actually, but when I am shopping in the grocery store or at the pharmacy, everybody's wearing a mask. Everybody, even walking from the store to the parking lot. So I'm wondering where people are shopping that they're not seeing people masked, like the mall, those kinds of stores. Because it seems to me that the people that are doing the essential shopping are pretty serious about masking. And even in the aisles, they're very reluctant to get near you they wait till you're through looking at what you're looking at and step away and say, excuse me. I mean, I've been very impressed, and I'm just wondering, it's kind of a shame that we're not back to just the essential businesses open, although I realize that's a terrible thing to say for the businesses that aren't essential, that it is their livelihood, but that's just my observation.
No, and that's correct. I would agree with you that the grocery stores and the pharmacies, the people going in there, are really taking the precautions that are needed. And we do see that, but there's some of and I would say that's probably true in pretty much all the stores, I would probably say, that people are wearing a mask. I think where we're seeing the spread is probably more of gatherings, whether they're at homes or separate gatherings. There's only a few stores that a couple people have gone in that didn't have a mask on or put it late. Most everybody working in the store now has a mask on. But it does affect the business community as we're trying to get our whole community out of a high-risk red community as the whole state has increased. We need to do this so we don't keep affecting the businesses. I mean, we're trying to keep the businesses open as much as we can, but as much as we're not taking precautions, it is affecting businesses. We see the governor going down to restaurants to 25%. Obviously, that's a huge impact on restaurants. A lot of them can't do that and just gone to takeout. Some of the restaurants, just like different business sites, are picking up a couple cases themselves. So they have their staff that have come positive. So they've had to cut down on some of their staff and their hours. So as much as we can try to keep ourselves healthy in the community, we're trying to keep the business community open. And I think that's another important step that you made was a good point.
I think businesses have, at least the supermarkets have done a much better job in the last few weeks. They have people stationed
Yes.
there with hand sanitizer and masks if you don't have one on, and they're counting people again. I think they're doing better.
And hopefully that helps change the mindset when other people see that as reinforcement of
Right.
what we need to do. Okay. That brings us into the next step that we've been anxious to get to is the vaccinations. And I think as busy and spending our time on contact tracing and telling people the precautions, we're going forward to vaccinations. And we can see that we're in phase 1 now. And these are the 3 phases that have come out through the state governor's office and how they should be rolled out. And as we can see in December, we're in phase 1, which is getting the vaccination out to the hospital and hospital workers. So that has been done. As I mentioned, it's out into the long-term care facilities at the nursing homes and nursing assistants. That has been done and ongoing. And now we see first responders, police, fire, and emergency medical services. They will be getting their shots pretty much across the state starting this week. We have scheduled our fire and police for this week, Wednesday and Thursday of this week, for half their shifts. And the second half of their shifts will be going next week, Monday, Thursday. That's pretty much how all the police and fire are dividing shifts. So if there is any reaction, it's not on one particular shift. So that is starting this week. So that's great. And then from there, it will get down to other home-based healthcare workers for their shots. That brings us into February, which isn't that far away for phase 2, which then gets into people over 75 or with 2 healthcare conditions. And I have that other chart with you, but I want to just stick on this one because it's hard to read the individual one. So as we get closer to phase 2 within a couple of weeks, again, age 75 and older and individuals with 2 health will be the first group in phase 2. That looks like it will be going through regional clinics, working with the county, conversations now with the county, and they will be at, they're hoping Upper Cape, Mid Cape, and Lower Cape. They're talking about possibly using the testing sites or additional sites, but they will be mainly through regional clinics. Hopefully the pharmacies will also be starting to give the shots out at that time. So that's the big thing, is what's going to unfold in the next 2 weeks. There is no date when that starts in February. It doesn't say February 1st. It will start as phase one completes, and then it will go into February. We do get calls every day in the health department. When can I get my shot? Where can I go? What day in February does it start? That will be well publicized, I'm sure, by the state, the county, and the town will be publicizing it through our website. We'll do a code red call, and we'll also update it on our video. So we're not quite sure of that date yet, but we know it's going to be rolled out, and that's also based on the availability of vaccine within the state to get that out. At this time, the health department will not be participating in an individual clinic site within town, because it's something that these clinics need to run every day based on nurse staffing and volunteer staffing. So the best way to go forward with this at this time is through the regional clinics that we have discussions with the county. After we get through age 75 and people with two conditions, it goes down to age 65 and people with one condition. And then we also see at that point in time, we get into education, teachers at the school, K through 12, grocery, utility, food, agricultural, restaurant workers, food and veg workers, consumer goods, retail workers, food pantry workers, that it gets more out into the community, which will be the big push in February through April. And then by April, it will be opened up to the general community. I have asked the state when will it be getting out to homebound people, people that have, let's say, visiting nurses service or that are homebound. They have not provided the state has not provided vaccine at this time to the home agencies that need to get out to that homebound population. So hopefully the state will clarify that this week very soon to get that out, because we do get a lot of calls on that. We get a lot of calls on I'm elderly, I don't drive, where can I go? So hopefully the pharmacies will start providing that at some point in time. But what I try to tell people is, to remember as the state goes forward with this, if you think of when you got your flu shot, people had their flu shot opportunity back in August, and they've had 6 months to get a flu shot over a 6-month period. So it's not like everybody got a flu shot in 1 or 2 weeks. It went over a period of time. So I think we need to look at getting our vaccination over the first several weeks. And that's what we're working on now, to publicize that as much as we can.
Bruce, I think it's important for the whole board to know. I mean, you and I have been on these conference calls with the state and with the county, and we haven't been provided with a whole lot of details on how this is going to take place. February, as you said, is coming up in a couple of weeks, and you talk about thousands of people who are going to need to get vaccinated, compared to us doing the fire department, police department, which was a lot of work. It really fell upon you mainly. A lot of details just to get, how many people, 80 people? How many were getting vaccinated this week in the two departments?
2 departments this week is about 80.
Okay.
This week, and another 70 to 80 next week.
Okay, phase 2, we're talking about thousands of people. And we just haven't had any details. They're not going to be online at CVS. That's not realistic. There are people who do their regular shopping and getting their prescriptions there. So it's hard to know what's coming.
And I think the other difficulty when it does get to CVS and some of the local stores is right now there's also a 15-minute post-vaccination wait. So you're going to have that group of people waiting while you still have the group of people waiting to get in. So you're going to have a potential logjam and people within 6 feet of otherwise either waiting to get a shot or waiting to get released after 15 minutes. So even a drive-through, they'll have to wait till they get cleared. So we'll get there. We're going to get there through this, but we just need to be patient over the next couple of weeks. And
Bruce, I have a couple of questions.
Sure.
what has the acceptance rate been at the long-term care facilities that have had the vaccine offered?
It's been very good. It's varied between residents and staff. It has not been 100%. Offhand, I don't have it. I want to say it's been at least 80%, probably the residents getting the vaccine, not quite that high in the staff. So, but they keep mentioning it to the staff and monitoring the staff. All staff going to our nursing homes and long-term care facilities do get checked every morning. They do check them with a temperature check, and they do ask them questions how they're feeling, and that's every day. And we also see that being asked besides the town hall here, just ask the questions. The grocery stores and pharmacies and other businesses are asking the people that same question.
Thank you.
Thank you.
Mary, you said you had a couple of questions. Anything
Oh,
else?
In terms of the fire and police, is it are they getting the Pfizer or the Moderna, and who is providing the inoculations?
Okay, they're getting the Moderna vaccine. It's coming through the county health department. I partner with the county health department on them obtaining the vaccine, and they'll be providing either a county nurse or somebody from the MRC Medical Reserve Corps to give the shots tomorrow. The fire department paramedics have also been trained and certified if needed to give shots also. So they've have done that in the last several weeks too to get certified.
One of the problems, Mary, with the Moderna, of course, is the refrigeration requirement, as well as comes in cases of 100 and trying to avoid waste.
Right.
When
But
you
that's
try to
better than
match
the
up-
Pfizer.
I'm sorry?
That's better than the Pfizer, which comes in what, 900, and it's the temperature requirements are even more severe,
Correct.
right?
And I think that with the severe temperatures and the below zero temperatures went to the hospitals who has that set up and the amount of people.
Right.
that use it. So they went to the healthcare facilities first.
Right.
It's easier for the county to handle. So we're going to continue to work with the county health department on using their nursing and on the regional clinics.
Thank you.
Welcome.
Bruce, I just had a question. So the way it's working is the state is getting doses of the vaccine and then leaving it up to the individual counties on how it's going to be allocated?
Yes, the counties are participating across the state, and individual towns can participate across the state also. So it's a little of each. So we do have some towns that have larger nursing staffs that are looking at doing their own. I know Barnstable is using their public health nurses and working with their individual police and fire. And then up in Sandwich, has been working with their fire chief and their nurse. And they've kind of had their own little sub-region clinic that they're working with Sandwich, Bourne, Mashpee, and Falmouth working on theirs. So it's a little bit of everything as the state vaccine becomes available and requested.
So the towns can determine whether or not they want to kind of do their own jam or
Correct,
basically, and you're saying we can't because we don't have enough staff to do it.
correct. If you wanted to do it every day, that's correct. That's correct. Because you'd be doing thousands. And I think we're used to doing a flu clinic where we do 300 people up at St. Pius.
Right.
One day, just one day. And that's using all our staff and using 6 staff, either from VNA or the hospital. And, can they still free up 6 staff that might be doing contact tracing in other locations also, vaccination. So it's going to be a lot to get out to the public. And I think from our planning, it was going to be helpful to work with the county.
Okay.
At this time. At a later date, as it becomes more available, whether that's into phase 2 or phase 3, that we might be able to get in to do a few local clinics like we did with the flu clinic. That is something that we're also considering.
Right. That's kind of what I was wondering, because once phase 1 and phase 2 I would imagine hopefully quite a bit of people will have already been vaccinated. And I know it's a 2-dose situation as well. So then they all have to get their second doses. And I know I've seen or read that some states are just giving everybody a first dose and then going back and giving everyone the second dose. And I
Right, they're saying get the first dose out, don't hold back holding the second dose,
Right.
get it out first. And I think Massachusetts has just mentioned that maybe they should try to get all the first doses out first. So that's, that's still a part of the discussion right now on the state level.
Sure. Okay.
The pharmaceutical companies have not supported it only because it hasn't been tested that way.
Right, and I understand that as well. I just was wondering how it worked. I mean, I care that everyone gets it in, all of Cape Cod, but I mean, obviously, I'm more concerned for how everyone in our particular town is going to get their doses.
If the county wanted to supply people first, we could do it, but right
Right.
now that doesn't seem to be happening.
Yeah, that's too bad.
It is too bad. We could take care of ourselves, but not with what's being provided. It's been difficult for Bruce to even get nurses lined up on time for this week to just give the doses to the fire department and police department. So we need a lot more than that.
So, but I'll continue to work with the state to see what we can do to get doses out to the health agencies, they can bring it out to homebound people. I think that's the big area that I need to concentrate on for the board to relay that message to the state. Continue to relay that message to the state. Okay, as we move in, this is just the fine print of what was going out to the next phases. We can go right by that. We'll go right to this. We had a code red call go out Friday that I gave the information to the citizens of where we stood with a number of COVID cases around town and precautions that could be needed. And what I understand from talking to the community that they appreciate getting the updates of the code red from the Board of Health and the Health Department to know what's happening within the community. They read the Cape Cod Times, or they might jump on or hear the radio or TV, but specifically what is happening within the community, they appreciate the code red, almost a PSA update. So that will continue from time to time. From there, we've done several information videos that we just had one updated this Friday that I believe just came out online today. And this one is again going over the coronavirus numbers within town, which is I've done on the other three updates. And then this update is, as the other ones, I tried to talk to a department director within town of what the pandemic has an effect on their operation. And this one, Friday, I had met with Roby Whitehouse, the waste management superintendent that oversees the landfill. And we talked about the sign going up there, what she has done to promote requiring masks, what she's done to tell her staff what's needed, because obviously we're trying to keep the landfill open 7 days a week. If their staff becomes infected or down with COVID, then we would not be able to keep the landfill open. So it's important that that works just as much as we're trying to keep all town staff and businesses with precautions so they can stay open, whether it's a restaurant or fire, police, or town hall, that precautions need to be taken for that. So it's a good interview. I tell people listening at home, we'll get this out. It's been posted up on our social media page. And I think it'll be helpful for the people to understand. I did spend some time within this one on vaccinations, and probably the next one will have more information about vaccinations as we roll it out. We do talk a little about recycling at the end of this, what they do for recycling, which has been important as part of continuing that. And I'd like to give a thank to our Zoom master Meredith here. That's within the health department. Besides helping us tonight, she's been outstanding to put this videos together. It's not easy. She does a video together at wherever we visit, whether it was at the library or the food pantry or the senior center. And then we had discussions there, and then she would edit to that, and then we'd do mine separately when we get the information from the state on a Friday morning and edit to that all together. And she's terrific editing everything and then able to get it up on the website. So last month was the food pantry. We had it up on the website, and I want to say we had almost 700 views so far. So,
Yeah, they've been great. Thank you very much.
Yep, very good.
So I think that's getting out into the community besides the code red calls, signs out there, is trying to get people to understand that we're trying to also relay the message through the videos that I hope they're watching. We do have this on social media and on our town webpage also, and the health page. So thank you, Meredith, for doing that.
You mentioned the website. I had asked the board members to take a look at the website. Anyone have any comments of any updates that we need, anything?
I think it's a mishmash. It's kind of jumbled. I mean, it requires a lot of toggling back and forth, and my Wi-Fi isn't always very fast, and so I had to wait, and then I wasn't sure I'd got to the right place. There's information on there that's outdated. Maybe it could be archived and put in a separate spot so that if people wanted to look back and see what had happened. But I think that it needs to be, culled, trimmed, and I'd keep. And also, there's some places that there's information about something, and then there's information about it somewhere else. And I just think it needs to be simplified. I think there's a lot of stuff that needs to come out of there, and then just kind of organized better in terms of, what people might be looking for. That's my thought.
Anyone else?
Yeah, I agree with Meredith. I find the site to be a little, I guess, busy because, and I was going to say exactly what Mary said, to archive, see here for previous updates or some sort of clickable link, so that when you do get on the site, everything is just kind of like super current.
Right.
Bruce, the same person is overseeing it?
Good, get on. We have a couple people that oversee it, and I know that it's not always COVID related on the COVID site. There's other issues that go in. So we're going to pass these messages along to our website person that monitors that, along with making sure our COVID information stays up there as needed.
Okay, great, thank you.
The one thing that I noticed in particular, kind of, with regard to what Mary was saying, there were statements on there about mask wearing, and they were probably prior to the government mandates of, anytime you're out in public, you need to wear a mask. The wording there, I think, was just like a suggestion to wear a mask, so clearly those were kind of outdated statements. So just, to clarify, obviously everyone needs to have the mask on when they're outside in public. That was like the kind of the one big thing that I noticed.
Thank you.
Yeah, so as we kind of work towards trying to get the whole community to work on social distancing, no gatherings, wearing a mask. We need to get the whole community to help us get out of the red high-risk community. We do have our Zoom master that has just joined us from the background, Meredith, with a nice wave. Thank you. You're very well appreciated, all the hard work putting these grants together. So thanks that. I also want to say on behalf of the Health Department Board of Health, she's applied for a county grant with us to work on drug awareness and to get that out. So we have that grant in that hopefully this spring, because we also have the coronavirus has also put a strain on, besides the food pantry, response to drug and so forth. So appreciated on that grant that you've applied for. So thank you. And if we get some more information on that, she'll make a presentation at the next board meeting on that grant.
Yeah.
Besides her Zoom master, she also is right now is a housing inspector, intern housing inspector. And she goes out and does housing inspections and handling the housing paperwork, issuing permits, and going out on some complaints, COVID complaints. So thank you for that too.
Is there anything she can't do?
No, she can do it all.
That's what I'm hearing.
Any difficulty on the housing inspection front?
Right now, we're trying to just do housing inspections that don't have people in the house, that we can work with a realtor or a homeowner that will allow us to get in to do an inspection. So we're not in doing inspection when there's multiple people in the house. Pardon? Yeah. The other part is her and the housing inspector are following the state short-term rentals, that the town received a list of the people that had short-term rentals. That was about 400. And they worked very hard to get a notice out that they needed to register. And right now the town's looking at, from just the short-term rentals that the state notified us, is bringing in about $1 million of housing short-term rental money. And their towns plan to use that towards their wastewater project.
Great.
We will see a benefit from that, because getting those people to register with us will be extra money that will help pay for this position also. So that's been great work on that behalf.
How does the state get that information and we don't have it?
The state gets it because people are required, if they have a short-term rental, they have to register with the state under the Department of Revenue. So even though they might not have registered with us, they've been skipping us, they do register with the state. We asked the state to ship us the first quarter listing, which they did do. And then we compared that list of 700 to the 2,500 to 3,000 list that we have, that which ones were not on our list, and we sent them a separate letter.
And the second quarter, maybe even more, because then you're talking about summer,
We might pick up some more, that's correct.
right?
So
Good.
by sending out an extra 200 letters on top of the 2,500 that we have going out, a lot of mail coming back that she also tracks and has to do turnovers and watch the money coming in. But a lot of phone calls, even from the 400 short-term rentals. They said, oh, we didn't know we had to register with the town also, even though we've had the regulation since 1975. We will be putting a note on the water bills when they go out, reminding people to register all their rentals with the health department. So we're trying to reach as many people in the community as we can. Okay, we're also on the short-term rentals. You know, we do get calls from landlords that, you know, tenants aren't paying rent because they don't get evicted. So we're having landlords call us on difficulties trying to get repairs. We're still responding complaints of either no heat or so forth. So we're still responding to tenants and landlord complaints and issues.
How do you respond if someone's not paying rent and the?
Yeah, we leave that. That's really a legal issue between the landlord and tenant. That's a difficult one. Obviously, if the tenant doesn't pay, the landlord sometimes doesn't have the money to make the corrections. But they still have to go forward. That's no excuse for them not to make corrections. So it's difficult. Okay, as we move forward, our next slide, Ms. Zoom Master. We'll end up with, this is our last slide of the presentation tonight before we can go to other business, is the meeting with the selectmen tomorrow night. We were originally informed that we were going to have an agenda item with the selectmen, and because their agenda seemed to fill up, they have now moved the Board of Health presentation to just public comment at the beginning. So what we'll do is I'll we'll give them a PowerPoint of just the slides that we had first and talk briefly on each one, highlighting the number of cases, active cases, number of deaths that we had in town, what we need to do as a community to try to work on getting out of a high-risk community, and maybe touch on vaccination if we have any time. Mr. Chairman?
Yeah, we'll see. You can field questions if the board has any. So everyone's welcome to join us. Where we'd be first up, open, public comment. That's sort of where we are in the agenda.
I have sent each board member the information in the hot link of the selectmen meeting, so you should have that for tomorrow night.
Thank you.
I think we're down towards the bottom here, new and old business. Anyone? Including Director Murphy, anything?
The only other message I wanted to mention is, besides getting boards out, we do have the one now in front of the rec building on Route 28, right by CVS, across by 99 Restaurant there, the rec building. They have a message up there about COVID precautions also. Along with the school, also runs it on their school message board in front of the schools. I have touched base with the school nurses I mentioned earlier, and touching base with them because they do have athletics starting this week and the precautions they're taking. So that's just be another area that we're monitoring.
I think I mentioned the last meeting about the mental health piece, and I noticed on the board and the DY school, because I live near DY, so I drive by it all the time. They have a really nice on their electronic board about loneliness and something that sort of makes you think as you're driving by. And I thought, in terms of the website, if there's any kind of information that we could put on there for people that are housebound or experiencing any kind of mental health problems or things like that, I think that would be a helpful resource.
Yes, we'll try to add that to at least to our screen at the rec building, and we'll see what we can put up on our webpage also. Thank you.
I have a comment just about vaccines. I know that there's plenty of folks out there who don't necessarily get regular flu vaccinations or regular vaccinations. So I guess it's more of a comment to the public, but nobody's died from the COVID-19 vaccine. So people are dying from the virus. So it's just kind of a reminder for those who may be apprehensive about the vaccination. And I don't know logistically, if you pass it up, when's the next chance to get it again? So it's just kind of something I think to keep in mind in terms of, if you have questions about it, you can reach out to your medical providers and such now, so you can be prepared for when you come up, whether you're in phase 2 or phase 3.
Good point.
You're right. I'm not aware of any deaths there. There's been 1 or 2 out of a million so far.
Yeah.
Where people have any severe allergic reactions. So which is the equivalent of the flu vaccine or even less.
Yeah.
So yeah, so far it seems very, very safe. One of the things to keep in mind is we'll have to deal with masks also. In other words, just because someone gets vaccinated doesn't mean they're not infected and could pass the virus on. So it's going to be even more difficult to enforce the mandate to be wearing masks in public. Anything else, new or old business? If not, we can move to adjourn at this point.
I move that we adjourn the meeting.
Second, anyone?
I'll second.
Okay, all in favor, just kind of waving the screen there.
Always
Okay,
waving.
here we are. Passes. Thank you, everyone, and stay safe.
Stay safe.
Thank you.
Have a good night, everybody.